Hi, my name is Heather Gregg. This is my discussion board post for week 6 on the neurotransmitters acetylcholine and histamine. In this presentation, I will discuss where these neurotransmitters are found in the brain, the receptors that they use, how excess and deficiency of this neurotransmitter can contribute to psychiatric illness. I'll list a few disorders that are affected by the neurotransmitter and then provide you with my scholarly references that I used. To start off, where is it found in the brain? So this diagram actually describes the acetylcholine's cholinergic, which is represented by brown, and it also highlights dopamine. We're just going to be discussing the cholinergic brown. There are 4 primary sources for cholinergic projections in the brain. These are the brain stem peduncle pontine nucleus and lateral dorsotegmental nuclei. Then we have a subset of thalamic nuclei. The third is the stratum, where cholinergic neurons serve as local interneurons. And the fourth location is the basal forebrain nuclei, which collectively serves as a primary source for cholinergic projections that extend into the neocortex, hippocampus, and amygdala. Histamine neurons are located in the tubular mammillary nucleus, if the posterior hypothalamus, and then sends their axons all over the central nervous system. The neuropathways and receptors. So histamine receptors mediate cellular responses to histamine. Histamine can be released as a transmitter in neuropreparations or as a mediator of the anti-inflammatory response by mast cells. Currently, we know about 4 histamine receptors. They are H1, 2, H3, and H4. Histamine receptors are widely distributed in the body with one or more receptor with significant levels in neuronal, smooth muscle, which would include vascular, gastric, and bronchial, and blood, heart, immune systems, and endocrine systems. Medications have been made to target these particular receptors. So if they're looking for anti-inflammatory effects, they usually go for H1 receptors. If they're looking for anti-ulcer effects, they go to H2 receptors. And if they're looking for sleep, they go to H1 receptors as well. Our acetylcholine targets nicotinic and muscarinic. The muscarinic is then divided into M1, M2, M3. The location of muscarinic receptors are in the brain. For M1, they're abundant in the neocortex, the hippocampus, and the neostriatum. M2 are located throughout the brain. These are inhibitories in the hippocampus and the cortex, non-cholinergic terminals in the hippocampus, cortex, and olfactory bulb, and also in our basal forebrain and our thalamus. M3 has low levels throughout the brain in the hippocampus, thalamus, striata, and GABAergic neurons. There's also M4, M5, but those will not be discussed here. So if we have an excess or a deficiency in either of these receptors, we're going to have effects by them. Histamine, a lot of drugs try to reduce it. We have our histamine blockers. If we have low levels of histamine, we're going to have sedation. We can have weight gain. If we have too much histamine, we can have alertness, It stimulates our gastric secretions. And then acetylcholine is balanced usually with dopamine. Acetylcholine plays a role in our skeletal muscles, our arousal, our memory, our sleep-wake cycles, because if acetylcholine is deficient in Alzheimer's disease, we see that that's what causes us to have problems with our learning, our memory, changes in our mood. We can also, if we have excess, have issues with our behavior, and it can also stimulate the parasympathetic nervous system. So some disorders that we can see with histamine, if histamine is reduced, we can have sedation and weight gain. And then in acetylcholine, if it's reduced, we can have Alzheimer's disease, Huntington's, Parkinson's, and then increases, we can have depression. And these are the references that I used, and thank you for watching my video.